to the Offer Your Voice podcast. I'm your host, Michele.
And I'm your host, Gina.
And we are so glad you're here with us today. Today, again, we have a wonderful guest here with us, Michele Bennett. Yay. Thank you, Michele, for being on the podcast.
Thank y'all for having me. I'm so glad to be here.
Absolutely. Well, today we're going to have you offer your voice and share a little bit about what you do, kind of your background, the things that you're focused on, particularly for this month. And so why don't you go ahead?
Okay, will do. I am with Lower Cape Fear Life Care. We are the only nonprofit hospice and palliative care provider in Coastal Carolina, which is something I'm really proud of.
Yeah, I was going to say, that's quite a statement.
Yeah, it is. We also, in big news, just got our 5-star Medicare rating.
Oh, that's wonderful.
About 8% of hospice providers nationwide get 5 stars. So we're just like...
That is significant.
Congratulations.
Thank you.
Yes, big deal.
We've worked really hard for that. And the stars come from surveys that are sent out to caregivers after their loved one has passed away. It's an anonymous survey. So that's, we're getting that rating.
True and real feedback.
Yes.
Yeah.
That's not just something, that they look through our paperwork or something like that. It's a really big deal. So we're very excited about it.
Well, I know that you shared with us, with the Chamber of Commerce a while back, a bit about, kind of the overview of all that you do. So kind of share with the podcast folks, tell us a little bit about what you do.
Okay, so I am responsible for community engagement and volunteer coordination, and that is for Onslow, Pender, Duplin, and a little bit of Carteret.
Okay, that's quite a territory because, even just Pender County is quite a large county, and so is Duplin.
Yeah.
Yes. There's a lot of drive time involved in my work, for sure. Spend a lot of time in my car. Somebody the other day looked in my trunk and said, "Do you live out of your car?" And I said, "I travel for work. I basically do."
Basically what I do.
I basically
sort of what
do
it
live
looks
in.
like. Yeah.
So we, Life Care actually rebranded in 2020. I think I've got that year right. From being called Lower Cape Fear Hospice to Lower Cape Fear Life Care.
Okay.
Because we offer much more than hospice services.
Right.
Yeah, that is something that I found so intriguing because, and we'll get into that in a little while, or, you can get into it now either way, but just even learning about dementia care and all the things that you've taught us over the time of knowing you, it's been fascinating to me, things that I did not know. And I've given your information out to people who are working through these things because they also didn't
realize,
know that this was something that they could
help
have
that was available.
Access to. Yeah.
Right. Yeah. And that's a large piece of my community engagement role is getting out into the public and providing education on who we are, what we do, the fact that we do, in fact, serve Pender, Onslow, and Duplin. I can't tell you the number of times I have presented to a group, and at the end of the presentation, someone will come up to me and say, "Oh my goodness, I didn't even know you were here." So that community education is really important.
That the Lower Cape Fear actually covers quite a large territory.
It does indeed. We're actually in 9 counties, Horry, South Carolina, Columbus, Bladen, Robeson, Brunswick, New Hanover, Pender, Onslow, Duplin, and we do serve some patients in Carteret.
Wow.
Amazing.
Duplin and Carteret are actually the only 2 counties where we don't have a brick and mortar. We have a brick and mortar building in all of the other counties.
That's incredible.
Okay. Wow, that is incredible.
But, it's such a great need.
Yes, absolutely.
Right now, currently my family's going through this. My Aunt Christine, my mom's older sister, we're at the end of life care. She'd gone through a season of dementia. And it's very sad for our family, and so having support is significant, and so I can certainly attest to having that.
Well, good. I hate that you're going through that, of course.
Absolutely,
but
yes.
The support, and that's one of the ways we describe the difference between hospice and palliative care. Hospice is comfort care, and it's not just comfort for the patient; it's comfort for the loved ones of the patient.
Absolutely,
right.
It's extra support. It's a lot of times a relief.
Yes.
The services we provide are very important.
Yeah, they are.
And you go directly into even working with with facilities, because right now she's at the Laurels in Pender County, and I know that you have outreach in all of those different areas.
We do. So yeah, that's one of the things that a lot of people don't know is we provide 90% of our care in home. A lot of people confuse hospice as being a place rather than a service. We do have 3 care centers, one in Wilmington, one in Bolivia, which is in Brunswick, and one in Whiteville.
Right.
They do not have many beds because we know that most people like to have their care. They want to stay where they live. And so exactly, Laurels of Pender is where someone is living. So assisted living,
Right.
skilled nursing facilities, we provide care where a patient is living.
Where they are.
Yeah,
That's awesome.
absolutely. Because that's, where people find comfort is where they live with their loved ones.
Yes, with their things and the
Yes.
the things that they
Their
know
pets and
right.
absolutely.
Yeah. So tell us a little bit about even dementia care, because I mean, I'm sure you know the numbers. I do not know the numbers, but it just seems, at least in my circle of people that I know or am affiliated with, that dementia is on the rise. And maybe it's not, it just may be in my circle. I'm getting older. So, who knows? You may know the answer to that, but also what does that care look like? Because that was fascinating to me that I didn't know people could have access to.
Yeah, it is on the rise. Unfortunately,
Okay.
it's not just,
Yeah.
your circle. We have a service called Life Care Memory Partners, and that is for folks who are living with a dementia-related illness and their caregivers. It's a consultative service, but it's still provided in-home. It provides a lot of support for the caregiver. We offer a ton of free community education. I'll come and talk to a group of 2 or a group of 200. It makes no never mind to me.
Well, that's wonderful. That's so
Yeah,
Well, I mean, again, this is my community.
Yeah.
That's a gift. Yeah.
So it's really important that people know about that.
absolutely.
And then too, with a dementia-related illness, because there's certainly many more than just Alzheimer's. There's a whole host of different kinds of dementia. A lot of times we'll have a patient who will start with memory partners, and then as that dementia-related illness progresses, we find that they sometimes will transition to our hospice care. So and that's one of the things that about being a nonprofit is it's not that we don't take money in. Of course we do. We have to have the doors open and have the care centers manned and all those things.
Yes.
But it means that the funds that we do bring in go directly back into our programs,
Yes.
to our care centers. And, we are the only hospice palliative care provider with care centers because they are not moneymakers. So that's why you'll find that other hospices in our area don't have care centers. It also, as a nonprofit, means that we don't have any overarching, we can't take this kind of patient, or we are blessed to be able to, when we receive a referral, blessed to be able to evaluate on a case-by-case basis what services a person might be appropriate for, because we have folks who move around our services. Palliative care is for individuals living with a serious illness who are seeking treatment. So that's curative in nature.
Okay.
Hospice is comfort care, because that's for folks who are living with a terminal illness. There's a prognosis of 6 months or less to live, and they are not seeking treatment.
Okay.
So, being able to put those funds that we get back into our programs to be able to build them out, to be able to evaluate on a case-by-case basis is just, I'll probably say 30 times during this podcast, one of the things that's most important to me, but there are a lot of things that I really love about what Life Care is doing.
Yeah. That's amazing.
So November, you were saying that November is a highlighted month.
It is.
For your organization.
Yes.
Tell us a bit about.
So November is National Hospice and Palliative Care Month. We have a couple of towns in the counties that I'm responsible for who will be, during their town council or city council meetings, read a proclamation that they are also acknowledging that month.
That's so good. And that's happening in Burgaw, right?
It is. It
That's
is.
so
It
good.
is happening in Burgaw 2 weeks from now, I think. Don't quote me on that. But yes, Mayor Dawson will be reading that proclamation,
That's
and
great.
we hope to have a good turnout of employees there to, just show our support.
That's wonderful.
The other big thing that's happening in November is, of course, Veterans Day.
Yes,
and
November 11th. Yes.
If you're asking yourself why that is important to Life Care, good question that I'm about to answer. So we are a level 5, we honor veterans provider.
Okay.
And the VA, Veterans
Yes.
Veterans
Yeah.
Affairs,
Yeah.
Veterans Administration, rather. So that's something we have to recertify for every year.
Okay.
We have
Okay.
continuously had 5 stars. That means that our employees go through additional training about how to provide support to veteran patients.
Okay.
We are also always seeking veteran volunteers. Our goal is to have one-to-one veteran care. So when we have a veteran patient, we have a veteran volunteer coming
That's
in.
wonderful.
Nice. Yeah.
We also have pinning teams. And just for the first time since I've
That's
been
beautiful.
at Life Care, we have a pinning team that supports Pender and Onslow. They are called the Penslow Patriots.
Oh, that's
And
cute.
yeah, so they go, and when we have a patient who is a veteran that would like a pinning ceremony, they go, and it's lovely. It's just it's so
Special.
It's so special, not just for the patient, though. I'm always a little bit surprised when I see one how emotional everyone still gets.
No, I'd be crying like a baby. I know.
So
Absolutely.
yeah.
they
That just
read
sounds
a
beautiful.
proclamation, and we have this really cool pin that was designed especially for us with our logo and the American flag, and it's for our veteran pinners to acknowledge and honor the service of the veteran patient.
That is incredible.
That really is beautiful.
It is.
I love that so much. Yeah.
It's lovely.
And what just an additional thing that you guys do. Like
Yes.
that's just
An
one
extra
more
step.
step.
Just
No wonder
one
you have all
more
the gold stars
honoring.
and 5-star
Yeah,
reviews.
right. I mean, it's true. But when you honor people like that,
Yes.
with such dignity,
Yes.
and
Yes.
respect for a life lived, I mean, that's
A life of
that's-
service, a
That's
life
definitely
of giving. Yeah, it's
above,
beautiful.
Yeah, above that, and that every life matters.
Absolutely.
I mean, but you wouldn't think you have to say that, but but like it's a beautiful thing that you guys just honor life and keeping people's dignity intact too, even by all the home service and all that.
Thank you. Yes, that is
beautiful.
really important to Life Care.
Yeah.
For sure.
Yeah. Tell us, do you guys take insurances? Like, tell us a little bit about that kind of behind the scenes for someone who's like, I don't know, can we afford, I don't know what to do. What are my next steps? Give them a little bit
Right.
of directive on that.
Yeah, great
so that-
question. We do accept insurance. We take Medicare, Medicaid, and private insurance.
Okay.
But the other super amazing thing that we have is a foundation. We don't turn anyone away for inability to pay. So if you are uninsured or underinsured, that's okay. We provide
incredible.
about $1 million worth of care to folks who are unable to
That is
pay.
incredible.
So, yeah, another thing I'm very
Wow,
proud of.
bravo. Yeah, that's incredible. I mean, think about that. Talk about that just kind of reiterates what I just said about, that every life matters and that there's such dignity in that. So
And if
thank you
you're-
guys for that.
In nonprofit world, does that mean that you are funded by grants or support based?
Yeah,
How does
that's a
that
good
work?
question.
So we can apply for grants, and yes,
Okay.
we actually just received a sizable grant from the New Hanover County Endowment Fund, and that is actually going toward our Life Care Memory Partners
Okay.
to the tune of $5.1 million, as a matter of fact.
Wonderful.
Which is going to allow us to make Memory Partners even more robust than it is, so that when we are in, a little bit further out in Pender or a little bit further out in Onslow, we've still got the folks and still got the same services across all of our service area. And when you think about it, you're paying taxes, and so you're paying into this hospice benefit whether you or your loved one uses it or not. Unfortunately, we find that most people don't utilize our services until they've got about 14 days left to live. And I say that's unfortunate because they're missing out on that support, on that extra care, that in-home care where you've got a doctor who comes to your home, you've got a nurse who comes to your home, a social worker, a chaplain. It's a whole team
Incredible.
that
Yeah, a
comes to
team,
the
that's
home.
wonderful.
It's
Yes.
it's phenomenal. And so, a lot of folks feel that if you're calling in hospice, somebody must be at death's door. That's another unfortunate myth because we have folks who've been receiving our hospice services for no kidding years.
Right.
Wow.
That was shocking to me when
Yep.
I heard you say that the first time because
Yes.
I was like, I didn't know that was a thing. Like I didn't know.
Yeah, you think
don't know
about
what
it
you don't
in
know.
the very, very end of life care.
Yes.
And so to have that longevity, to have that support, what a beautiful,
Yeah.
beautiful thing.
That prognosis that I mentioned earlier of the 6 months or less to
Yes.
live, it's a prognosis. It's based on what the terminal illness is you have, but it's pretty generalized. So the reason you can be on hospice services for years is that you are declining, but it's not a rapid decline. We have all sorts of standards and measurements and ways that we track that decline so that someone can stay on services. But in the same vein, we have folks who graduate from hospice services. They'll come on service with us. The prognosis is 6 months or less to live. And once that team has come in and gotten everything together, they take it, they get
Take a
better.
turn for the
They
better.
take
Yes.
a turn for the better. Yes, thank
Wow.
you.
So good.
Yeah, so people can leave our services either because they don't need our services or because they want to go back to treatment. You can ask, you can say, yes, I want hospice services today, and then revoke that tomorrow. There's no obligation
So it's flexibility.
Yes, absolutely.
In that particular individual.
No obligation to keep
really
one
great.
service or not. And, we have a team who goes out and assesses for services. Anyone in the community can make a referral. So if you have a loved one, a neighbor, a church member, and you think, oh, gosh, I feel like maybe they need something that Michele mentioned, you can make a referral. Our website is just lifecare.org. There's a large place to make a referral, or you can always contact me to make a referral. And then a nurse goes out to assess, so you don't even have to know, right? You might know someone who's living with dementia and you think, gosh, that Memory Partners might be the right service, but I don't really know all of their medical history.
Right.
So that's why that nurse comes out and does the assessment to see which service, we might be able to provide.
This episode of the Offer Your Voice podcast is sponsored by Brown Dog Coffee Company in beautiful downtown Burgaw, where we micro-roast our coffee daily.
Come see us at the shop, 103 West Fremont Street, for great coffee and good vibes.
Or visit us online at browndogcoffeeco.com.
So in November, is there anything that you guys push? Do you want, are you looking for donations? Do you have some thing that people can put their energy toward? Or, what's your, I know when we did Safe Haven, they have a vigil and a walk and candle, the candlelight vigil. So I just didn't know if there was something in November that you all do.
We don't have any particular event like that. We do have a fundraiser coming up in December, our Jingle and Joy Gala.
Okay. Oh, yeah. Tell us a bit about that.
Yeah. Well, so it's actually our first year. We historically have done the Festival of Trees at Fort Fisher Aquarium.
Okay.
Yep. They are closed for renovation.
Yes.
And so,
which is going to be quite a project, I've heard.
Yes.
I have also heard that. I have heard that they had not yet started until I think recently. But so we have pivoted to Jingle and Joy, our gala. We'd love for people to buy tickets. Of course, that just goes back into our programs.
Yeah.
Someone can always donate to the foundation.
Is that going to be in Wilmington? Where is that going to be?
It is going to be in Wilmington at the Loft. I can't remember exactly the day, but it's again online.
Yeah.
Okay.
We're also,
Reference
of course,
the website.
the website. We're also on social media, on Facebook and Instagram and LinkedIn. So if you're not following us, please do. We sometimes have some really great pictures from bucket list events. So that's another. It is exactly what it sounds like.
That. Yeah.
That's again at no cost to a patient or their loved ones. If they've got a bucket list item, we try our best to help them check it off.
That is amazing.
So it can be smallish. We had a patient who wanted to eat tacos on the beach, so we arranged the transportation and the meal, and she went and ate tacos on the beach.
Love that. Precious.
Not long ago, we had a patient who used to work underwater, and he couldn't go underwater anymore, so we bought tickets for them to go to the Atlanta Aquarium because it was still sort of that immersive experience.
Oh, wow. That's amazing.
We've also got virtual reality goggles. And so we had a patient not long ago who went on safari, and the lions are around him and all that. So yeah, we try really hard to make those bucket list requests happen.
That's amazing.
That's really neat. That's really special.
What a wide breadth of support and services that you offer. I think I really think, as Gina mentioned, most people have no idea that's why you're position exactly.
Yeah,
to
that's why I'm
let
here.
Folks know. That's right. That's so good. Well, gosh, I hope that this will be just super informative for our Offer Your Voice podcast listeners and the folks that you're connected with as well. That people will hear this and then be able to connect with you and with the website. Tell us again the website.
Lifecare.org.
That's
very
super
basic.
Simple. Lifecare.
Very basic.
Perfect. That's easy for people to remember.
Yes. And we do, like I said, I'll come out and talk to any group. It doesn't have to be Monday through Friday, 8 to 5. It can be weekends. It can be, as a matter of fact, Kingdom Impact Ministries here in town.
Yeah. Okay.
I attended their Bible study and then I gave my presentation. So
that's awesome.
that was really special
That's
too.
Fun.
So
that is
again,
That's connection point with the community as well as the sharing the information for the community.
yes, and that's what is so important to me about my role. And one of the things that I love the most is letting our community members know what it is that we offer, how you can access it. And then we have other free community education as well, fall prevention, normal versus not normal aging. We've got a nurse educator who will come out for any staff who's looking for clinical hours, So
Oh,
yeah,
yeah,
we're really
that's great.
trying to,
Well, we can.
hit every point.
You did the class. I apologize. The name
okay,
has
I know what it
escaped me.
is.
Yeah, the elephant. Yeah.
Yes.
So you still do that?
Oh, yes,
class?
absolutely.
Yes.
We've got one upcoming in November. That is a workshop called Begin the Conversation.
Okay, begin the conversation. Yeah, it
Begin
just
the
has an elephant
conversation.
on the thing.
It
That's
has-
why.
That's because
why
the elephant. The elephant is our mascot because it's the elephant in the room.
Yeah, which
Because
I love.
it's talking about end of life planning.
Yes.
Which
can be
which is
difficult
amazing.
conversations. Sure.
But your booklet, the booklet that you gave out was so amazing. I gave it to all of my children. They range from age to 24 to 18, which it was, even that is kind of like, ooh, I don't,
It
I
feels
don't,
a little bit morbid,
it
but
was,
you also have to.
but my
consider.
24-year-old filled that thing out so fast. And I was like, you know what? This is so special to me. I never, ever, ever want you to leave this earth before me.
Sure.
Ever. But I know what you want now that I wouldn't have known. And so I get to value you even on a different level than I would have, Like, I mean, you know what I mean? With
Much
your
like
special,
insurance and how you and support and wills,
Yep.
like you have to have those conversations.
Yeah, you do. And I think the booklet that Gina was just talking about is very nuanced. There's even a question in there about what do you want to have happen to your pets in the event of your death.
Yeah.
And I have found that it's empowering for the individual who's completing the workbook, but it's also comforting to their loved ones because they don't have to make those decisions. You are taking a burden off of someone.
So good.
By making those decisions known. And then the other part of that workshop is an advance directive. It's a legal document in the state of North Carolina. It's also known as a living will or a healthcare power of attorney that does not get used once you have passed away. It's what is used in the event that you are unable to make your medical choices known to your loved ones.
Yes.
So we encourage everyone who's 18 or over to have an advance directive. I have an advance directive. None of us are promised tomorrow. None of us knows what happens when we leave here today.
It's true.
And so, having my loved ones know, what exactly I want it done, and then it's there. It's in black and white. It's a legal document.
Yeah.
And you leave that, begin the conversation with that advance directive if you would like. Again, that's at no charge to anybody.
So good. And the fact that it is a legal document, it covers that for the folks that are filling that out. We can certainly tell that you're very passionate about this work, which is wonderful. That's like our idea on the Offer Your Voice. Like, what are you passionate about, and what do you want to offer your voice on? So tell us a little bit, Michele, about kind of how you got to this place of in this position, but also just what motivates you, what gives you that.
So my career trajectory has not been straight by any stretch of the imagination.
As most people's have.
But most of my career has been in service to others in some form or fashion.
Yeah.
I also volunteer a lot in my community. And so, but I've been in law enforcement for quite some time on patrol. I've worked in mental health.
That's saying something right there.
It is. It's pretty impressive.
I know that we're in a day and age where not a lot of people look at that as a service to a community.
Oh, but it absolutely
it
is.
absolutely
yes.
is.
I agree. I happen to be biased, but I think, and then I actually came from community engagement at Novant, ended up at Life Care for all the reasons, or many of the reasons that, I've talked about today. The fact that we're a nonprofit, the fact that we are serving folks in their homes, the fact that we have this community education and all of these services built out. It's just phenomenal to me.
Yeah.
It's, I still, every time I give a presentation, think to myself, like, gosh, we really do offer a lot of really great stuff. And that's actually, Gina, I don't think I finished answering your question about what are we asking for in this month?
Yeah.
No event, but what I'm always asking for is we are always in need of volunteers.
Okay.
Our volunteers go into a patient's home and they provide respite care for their caregiver so that their caregiver can run errands or take a nap, go for a walk. Or they provide companionship to the patient or to a patient's caregiver. We have some caregivers who are uncomfortable leaving their loved one really ever. And so there's that sense of isolation outside of the team coming in.
And see, that's something I think folks don't think about at all. So that's incredible.
It makes it really hard. And so that's what our volunteers are for. They are amazing. We are, like I said, always seeking veteran volunteers, but any kind of volunteer in the community. The service requirement is minimal. By Medicare standards, we're required to have a volunteer who's on a care plan visit 1 to 4 times a month. That also doesn't have to be Monday through Friday, 8 to 5. We have several volunteers who work full time. So that's, I think, what I would put out as our
Okay.
request for
Yeah.
this month.
Okay. Yeah, that's
Just always seeking volunteers.
yeah. Serving so many people and so much, width and depth of territory that you need a lot.
You mentioned about the amount of, the counties that you serve. Do you have sort of an idea of the actual people that would kind of cover in the current? Or does it vary? Does it fluctuate?
It does fluctuate. I know that we have seen a real uptick in our palliative care patients. We do have a palliative care clinic in Wilmington, but if you aren't utilizing that clinic, again, that's a consultative service that comes out to your home. You can keep your primary care physician. It's just for when you are living with that serious illness. Everything comes back to, I describe palliative care as the center of the wheel, the hub of the wheel.
Yeah.
Because everything comes back into that hub,
Right.
so that, you're getting the best care that you can in the midst of, living with this serious illness.
So many things.
I know.
So many things.
It's always when somebody asks how long I want to speak, and I say, well, I can speed talk it through in 10 minutes, or
Right.
we can spend an hour together. It really,
Right.
it just depends on the questions and
there's
Well,
a
that's
lot
why
to
it's
cover.
so good to have, kind of long form podcasting, because you have a little bit more time
Yeah.
to sort of delve into the depth of, is there anything specific that you feel like you want to end the note on? Is there something specific to let our audience know?
I think spread the word. I'm happy to spread it, to come and visit and, spread the word to whatever group you're with, or class or HOA or sewing circle.
And they can connect with you through the website?
They can, but it's probably easier to email me.
Okay. Well,
And-
share
okay.
your email.
My email is M like Michelle, BENNETT @lifecare.org. And I think that'll probably be in one of the posts, maybe
will.
Yeah,
linking it back
Well,
to me.
Absolutely.
Yeah. So, but spread the word, share
Yeah.
this podcast with other people, let them hear what it is. If you don't have a group, or of someone who needs the information, just, keep it going through our community.
It's so good.
That's amazing.
Well,
Thank
we
you so much.
really appreciate you being on the podcast
Well,
and
thank you
sharing so
all.
much. It's such a beautiful, beautiful work of what you do, because having gone through it in the past, and then even right now in the current, it's so significant and needed for all families. Everyone is touched in this way on some level and at some point. And so it's beautiful. So thank you. Thank you for being a voice.
Well, thank you all very much for having me. I appreciate the opportunity to tell about life care.
Absolutely.
Absolutely. Thank you,
Again,
Michelle.
the website is
Lifecare.org.
lifecare.org. And so we'll put that in the show notes and just let everybody know about that.
Yeah.
And until next time, we'll see you down the road.